Hello everyone, welcome to my YouTube channel. This video is about 20 mistakes of new parents during baby's first year and how to avoid them. Every new parent goes through the learning process. Here is a list of common mistakes parents make and how to avoid them. Mistake number 1. Leaving baby in the bath alone. Never leave your baby in the bathtub alone even for a second, and even if water level is too low. Keep all things needed after the bath near the bathtub so that you don't have to leave the baby alone. And never entrust baby's responsibility to older siblings. Mistake 2. Not allowing baby to sleep on their back. Baby should sleep on their back, in their own crib, without any toys or soft bedding. This will prevent the risk of sudden infant death syndrome. Third mistake, not enough tummy time. When your baby is not sleeping, it's better to be on his tummy or held by a parent. Baby shouldn't be strapped down as he needs to move, stretch, roll and push his head up. Number 4. Not taking care of umbilical stump. Keep skin and base of the umbilical stump dry and clean. Keep base exposed in air and do not cover it with diaper at any time. If skin around the cord become red, swollen, tender or foul smelling, then take your baby to doctor immediately. Mistake number 5. Not burping baby properly. As a result, baby may spit up, gag or wake up in 1 to 2 hours and scream in pain. There are many burping techniques, but the best is over the shoulder burp. In that, place your baby high on your chest with her chin resting on your shoulder and pat or rub baby's back gently until she burps. Number 6. Failing to pre-burp. Now most of the parents think that burping should be done after the feeds, but experts say that you should also pre-burp your baby. This helps eliminate spitting up and gassy problem that babies often have for the first 2 months. Mistake number 7. Ignoring fever. Now if your baby feels warm, then don't just give paracetamol or any other home remedy by yourself. An infant's immune system is not strong enough to handle the infection. So if your baby feels warm, take the temperature and call your pediatrician immediately. Number 8. Confusing spit up and vomiting. Now vomiting due to any infection may be more frequent and baby appears unwell and dehydrated. And especially in case of meningitis, vomiting may be forceful. Now spit up is usually related to feeding and baby seems well and playing. Number 9. Taking newborns into crowded places or family gatherings, because this can expose baby to people who potentially have flu or another contagious illness. However, experts encourage daily walks with your baby, and it is also fine to sit in the backyard or on the front porch with your baby. Mistake number 10. Not letting baby cry it out. Babies can be perfectly diapered and fed and they still cry. Now for most part, crying is just part of being a baby. But if your infant is inconsolable for an hour and has a fever, rash, vomiting, a swollen belly or anything unusual, then call your doctor. Number 11. Not putting diaper properly. Diaper shouldn't be too tight as that will lead to rashes, and if it is too loose, it will leak. So perfect fitting is when you are able to put 2 fingers side by side between the baby's skin and the diaper. Now number 12. Mistakes in breastfeeding. Some mothers may not have their baby fully latched onto breast, so while baby looks like he is feeding, he isn't actually swallowing. Now breastfeeding mothers should consult a lactation expert if they have any concern or pain during nursing. Mistake number 13. Letting baby sleep too long between feedings. In the first few weeks of life, baby does need to be fed every 2 to 3 hours, even if he doesn't demand it. He do need to be woken up. Now, if your baby is growing well, it is possible to get a baby to sleep throughout night by 2 or 3 months of age. Number 14. Using too much soap and baby products. Now, baby's skin is very soft and sensitive. Do not use too many skincare products. A little baby moisturizer and a small amount of baby soap is all enough. Now, baby powder may lead to respiratory problems, especially in preterms. Mistake number 15. Neglecting teeth and oral care. Now, baby is never too young for encouraging good oral healthy habits. Don't give milk late at bedtime once the teeth have erupted. Now, use a wet gauze to wipe down the baby's gum and start using a toothbrush when the babies turn 1. Number 16. Not cutting baby's nail often enough. Now, nails of a newborn grow relatively faster and baby often end up scratching his own face or body. So, cut your baby's nail twice or thrice in a week. And best time to do this is when he is asleep. Number 17. Not properly installing baby car seat. Always get help to install it correctly. For newborns, make sure his head doesn't flop forward, which could restrict breathing. And keep baby's feet up with body reclined so baby can turn her head to side and breathe normally. Number 18. Fighting too much in front of the baby. Parents should look at the severity and frequency of their fights. Arguing occasionally is a normal part of living, but when people start to fight too much in front of their baby, it is just bad for his emotional and brain growth. Number 19. Trusting unreliable sources for parenting advice. Now, parents should be careful about where they get their information. Reputable and competent hospital or physician should be approached when making decisions about the general medical care and immunization of the babies. And the last mistake, comparing your baby with others. Don't let other parents make you feel as if your baby is somehow slow. Babies develop at their own pace and in their own ways, and as long as your baby is within the normal range, just relax. Thanks for watching. Please subscribe to my YouTube channel.